Can breast implants rupture? Short answer is absolutely. But there's a lot of detail and there is a lot of fear-mongering that goes into this question that we're going to dispel. The reality is breast implants are safe and long-lasting, but they're not permanent. And we always have to think about what happens if an implant has a problem. A rupture is a common one to think about, and there's a lot to talk about there. I'm not really going to talk about saline implants because who the hell does that anymore? I certainly don't. And look, they can pop. And it's very easy to know when they do because just everything deflates. I pretty much universally put in silicone implants. Just like this and like that. So these implants have had an absolutely incredible evolution over the last several decades to make them very sophisticated, very long-lasting, and very natural. So let's talk about what's going on. In the old days, the silicone implants that were made had shells that were super thin and had gel inside of it that was really watery. So it was like this perfect setup for a high rupture rate with a rupture that was an absolute disaster. I still remember when I was training, we'd go in and take out some of these implants and it was just a mess because it was like this soup of weird silicone stuff. You don't want to deal with that. Fortunately, that is something that is extraordinarily rare these days. The newer generation of silicone implants has evolved to a place where the characteristics are really what you want. The shell of these implants is either smooth or nano-textured, barely textured, and it is a shell that is thick. It's nice and thick, so it's robust, and it is hard to break this shell. The other good thing is the gel inside. You can see super soft and natural feeling, but it's more cohesive. By cohesive, what that means is this stuff sticks together, okay? So I can literally cut here, squeeze it out. The gel inside will literally bulge out, and when I let go, it just comes right back in because it really, really wants to stick together. And as a result, even if there is a rupture, this stuff does not pour out there. It generally just stays contained in the implant. That begs the question, well, what about rupture? Do we have to worry about it? Does it happen? How do you even tell if there's a rupture? Because silicone implants tend to stay together, it's actually kind of difficult to tell where you don't know if the thing is intact or not. Now that's kind of scary. This is the important thing to talk about. Well, what are these rupture rates? I actually think it's really interesting because right now, the rupture rate for implants over, let's say, a course of about 6 to 10 years, those are the most traditional timelines that the FDA requires, are pretty incredible. They're literally single-digit numbers over that almost decade of close monitoring after the implant has been placed. Now, there are newer implants to the market, such as the Motiva implant, which are showing even lower, I mean literally fraction of decimal rupture rates over time. Now, I think there are a couple of things there though. I think the Motiva implants are beautifully made and are going to be really great long term, but I also think that our techniques of breast augmentation have improved so much that a lot of the old school complications that we heard about were more a function of old school techniques that we just don't do anymore. And we are seeing that as time wears on, these implants are really lasting nicely. Because the data looks at even a couple, few percent, up to 8% rupture rate after about a decade, the general guidelines today are to start monitoring with ultrasound or MRI after about 5 or 6 years from the initial augmentation. And then again, every 2 to 3 years. Now, this used to be a big deal, and actually the FDA in the old days recommended monitoring with MRI after 3 years and then every 2 years afterwards. That was a big pain in the ass and no one wanted to do it for several reasons. MRIs were really expensive and really difficult to get. They are less so now. And also, ultrasound simply wasn't as good. Today, ultrasound is available in so many places. It is so easy to get. We have a beautiful ultrasound in our office where we can screen you for a breast implant rupture. And it's something that will allow you to take ownership of your implants, of your body, and really know what's going on. So it's not a pain in the ass to get screened, and it gives you confidence and guidance of the future. Eventually, the implants that you get in, they're probably going to need to be changed. These are not lifelong devices. So you want to know what the right time to do it is. In the old days, we used to say, hey, listen, you know what? You change them when you need to change them. When there's an issue, when they're falling out too far, you're not happy with the size, there's capsular contracture, there's something going on, you can change them. Today, we want to be a little bit more thoughtful, a little careful about it, and use ultrasound as a guide of looking at you to see if the implants have ruptured and to really help guide you as to what the right thing to do is in the evolution of your breast, because time wears on and you should be thoughtful about it. So a really important question here is, what are those changes that can compel you to change your implant? So number one, what can cause your implant to rupture? In general, it's nothing. There is very rarely a specific thing that happened that causes an implant to rupture. In the vast majority of cases, they're silent ruptures. Associated with implant rupture is often capsular contracture, and that kind of makes sense. Capsular contracture is when there's scarring around the breast implant, where that scarring can literally squeeze down that implant, and who knows, may cause some change in the implant to cause it to rupture. Beyond that, there aren't a ton of very specific things. We've certainly seen things like trauma, like a car accident, cause implant ruptures. I've even seen stories of people literally getting shot in the chest and the breast implant saving their life. I can pretty much guarantee the implant ruptured in those cases, but better ruptured implant than ruptured lung or heart. And beyond that, it's sort of that's it. Going back to other reasons to change your implants, though, just to finish the conversation, again, capsular contracture is a good one. Implant malposition or implant moving over time. You may not be happy with the size of the implant anymore, the style, the look, you may want to change it. Any number of things like that are gonna be reasons why you may want to get your implant changed. So it's a big, big topic. There's a lot to go over, but the more thoughtful you are about it, the more you kind of understand what the rationale is that we use to change implants, the more comfortable you're going to be with this thing that's in your body. Look, there's a lot of information out there about breast augmentation and breast implants, and sometimes it can be really overwhelming, but it shouldn't be. You need to know the rationale that your surgeon uses to manage these things, and it's pretty straightforward. With a little bit of knowledge behind you, you are going to have a much more comfortable and enjoyable relationship with these things that are inside of you.